Hello, this is Dr. Virginia Ellis here. Today I'm going to be answering a lot of questions that people have about cleanings and dental hygiene appointments. And here we go. Okay, so Dr. Ellis, what is proper dental hygiene? So I will tell you, Dr. Ellis will tell you that proper dental hygiene is flossing properly every day with proper floss and the proper flossing technique, and brushing your teeth every day with proper technique, okay? So proper dental hygiene is not just brushing and flossing your teeth every day, but it's also using proper technique with a proper floss and toothbrushing, okay? And dental hygiene also involves coming in to see your dentist and your dental hygienist once every 3 to 6 months. All right, second question is, what can happen if I don't practice good dental hygiene? Okay, what can happen if you do not practice proper dental hygiene is, 1, you can get cavities. 2 is you can develop gum disease, okay, and bad breath. So basically, if you do not clean your teeth properly, you leave bacteria behind on the surfaces of the gums, underneath the gum line, and next to the teeth, which can cause you to grow cavities, and it could cause you to have inflammation in the gums, which if persisted over a prolonged period of time can cause the gums to be lost or recede and the bone socket level to recede, okay? So, and also if you're not properly cleaning the bacteria off of your mouth, of the junk that, you get from eating food, you are going to have bad breath, okay? And that can definitely be a social and romantic killer. What are the main duties of a dental hygienist? Okay, so the main duties of a dental hygienist is basically to help the dentist in cleaning the patient's teeth and also educating and making patients aware of their dental hygiene needs. Also, they deal with a lot in educating patients and how to keep their teeth and gums healthy. All right, so that is the duty of a dental hygienist. They go ahead, they clean your teeth. They help you with the education on how to clean your teeth effectively and properly at home. And they do a lot of dental education. They help the dentist and you with that. What kinds of tools do dental hygienists use? The kinds of tools that dental hygienists use are called scalers. Okay, so I'll use a mirror, a pick. The pick is like, we call it the explorer. You go in there and feel around the teeth. You use a ruler called a probe. That's where you go 3, 2, 3. 4, 5, 6. Anything 4 and above, you don't want to have, okay? When we say BOB, bleeding and probing, you don't want to have that. That means that you're bleeding or we're touching the gums, and they shouldn't be bleeding because healthy gums don't bleed when you touch them, okay? That's what people use, that hygienists use. They also use something called ultrasonic or a piezo. Let me see. I think I have one here. Hold on. Here we go. They do use something like this. This is a water vibrator, and it uses high-frequency waves under a lot of water to break up stuff at the surface of the teeth and to lose the bacteria. And then we have the scalers, the hand pickers, okay? And we use them gently. They go through a lot of schooling to learn how to use these instruments properly so that they can clean your teeth effectively and safely. If you somehow get a hold of one of these instruments because you want to clean those teeth on your own at home, do not do that because it is very easy to start scraping off root surface level. Once in a blue moon, we do see someone who's destroying the root surfaces of their teeth because they got a hold of one of these scalers illegally, because regular people are not supposed to have those. You have to be really trained in using those instruments, okay? So what is involved in a dental cleaning is your exam, your x-rays, measurement of your gums. Obviously, your cleaning with the scalers and an ultrasound, that water vibration device that we use, and polishing to polish the debris and the biofilm layer of teeth, okay? So that is what is involved in a cleaning. And also education. We tell you what our findings are. We let you know all of your alternatives, to finding if you have a cavity or if you have gum disease, you need treatment, what your options are, what are the downsides, what are the benefits, so that way you can make an informed decision as to what you're going to do, okay? That's basically what that is. That's a hygienist teeth cleaning usually. Generally speaking, a hygienist teeth cleaning does not usually hurt, okay? It will hurt on occasion if your gums are inflamed. And the way you can think about this is if you get a bruise on your skin, it usually doesn't hurt unless you touch it. Have you guys gotten a bruise and then you touch it, go, "Ooh, that hurts." The same thing is the situation with your gums. If your gums are inflamed, when we touch them, they're going to bleed. Healthy gums do not bleed. When you touch them, ow, it hurts. And it's not because we're butchering your gums or we're being rough. If your gums are really inflamed or they're lightly inflamed, they can't hurt. You'll notice the areas where you're inflamed sometimes because you'll be fine and all of a sudden your gums will hurt in a certain area. That's like your body's way of telling you, hey, I got swelling and inflammation in here. And that's a mental note to keep in mind. Oh, when they were doing my cleaning, it was hurting here, it was hurting here. If you weren't hurting anywhere, good. That means you likely didn't have any inflammation in your gums. So generally, your cleanings will not hurt. Your dental hygiene teeth cleanings will not hurt unless you have inflammation. So if you do happen to have pain while having your teeth cleaned, let us know, or let your hygienist or your dentist know if you happen to live far away from us to see our office, and they'll try to work with you. Okay, what we do for our patients is we give them like topical anesthesia so that the gums don't hurt as much, or sometimes we have to numb some teeth in certain people. Some people who have root exposure, like teeth with a lot of root exposed over here, like for example, if there's gum loss and bone loss and the root surfaces are exposed, that will be sensitive for some people. And what we could do for some situations is put a desensitizing agent or just use our hand scalers and just, accommodate to your needs, okay? How long should a typical dental cleaning take? Okay, a typical dental cleaning should take, I would say, schedule about an hour if it's your routine recall or periodontal maintenance. What I mean by recall is if we advise you to come in every 3 to 6 months, that's called a recall. Periodontal maintenance is basically a recall for a patient with a history of a deep cleaning, okay? That's usually an hour. If you happen to have a deep cleaning where you have to have half of your mouth cleaned and then the other half at another appointment, and you have to be numbed up, that's usually 2-hour cleanings, okay? Instead of 1 hour, because you have to consider that like an auto detail cleaning. When you go get your car cleaned at a regular cleaning, it's usually a 20-minute job. If you go to one of these places where they have 5 people doing it at once, and then if you get it auto cleaned, detailed, that will be like hours, right? So it's the same thing in our office. You have to numb you up, where it's really much more detailed, kind of like the auto cleaning. So that would be about 2 hours. But generally speaking, for most adults and children in braces, I would say to properly clean a child with braces takes a lot longer because obviously it's harder to get through all that stuff in there around the brackets and all. So a young kid, little kids, I would say about half hour, okay? But someone that's got braces, a kid in braces, a young adult or adults, I would say schedule 1 hour. For the most part, you'll be walking out of here at about 5 or 10 minutes before the hour. So the whole appointment will probably take about 50 minutes, but we schedule an hour in case we need to take longer. And that also depends as to whether or not if you need x-rays updated or if you need to update your medical history at the chair, that will take longer. But sometimes if you're updated with your x-rays, all you need is your exam and you're very clean. Sometimes people come in with very little buildup in there. That's the best thing. It'll take less. But you come in and it's been a while, or you come in and you're not usually someone who's flossing, or you have a lot of inflammation, a lot of buildup of tartar and bleeding, it's going to take longer. It'll probably take the full hour. Okay, great question. Why is deep cleaning by a dental hygienist necessary? Because there is no way when someone comes in with a lot of bone loss, a lot of gum loss, and a lot of tartar buildup in the teeth that we can get to that cleaning as fast as you would with a routine maintenance cleaning. So again, I make the comparison of a car, okay? When you go and take your car and it's maintained and it's pretty clean, the 20-minute cleaning where 5 people are good, cleaning it at the car wash is going to be a lot easier to clean because there's less buildup. But when you've got like the mud, you go to the snow, you go off-roading or whatnot, or the kids that just throw all kinds of Oreos and what is that called? The cereal in there, chocolate milk all over the car. That's going to be caked on food. You're going to have to take hours to take it to the auto detailing place. So they're going to be spending a lot of time. So deep cleaning is like an auto detail cleaning. We're going in, we're numbing you up. We don't want you to grip the chairs because in order to get down to those deeper pockets, a person that has gum loss and bone loss is going to take longer to clean. So a dental hygienist has to do that cleaning, or the doctor. Dental assistants for most states, unless you live in a place like Alaska, I believe, you have to be licensed, and you cannot do a deep cleaning unless you're licensed to do deep cleanings in the state that you work, okay? So you have to numb up, and it's basically surgical cleaning. You're really cleaning in there with a lot of detail, a lot different from a regular gingivitis cleaning, gum inflammation cleaning, aprophia cleaning with healthy gums, no bone loss. Something that doesn't have a lot of bone loss or gum loss, it's a lot easier to clean. If you have a lot of buildup and we're not going to get in there with the instruments, we have to numb it up, clean it surgically, that's going to be a deep cleaning. And that's when a dental hygienist or a doctor will need to do your cleaning for you. 2 hours to do half your mouth in one visit and 2 hours for the next side. Is it necessary to do anything after a dental cleaning? And the answer, yes, of course. When you go home, here's the thing. A lot of people think, I don't have to floss. That's what I'm here for, to get my teeth cleaned once every 3 to 6 months. No, guys. What happens is what you do at home is super important because it's how you maintain over a long period of time. You can't expect our cleanings to make up for the part that you're supposed to do on your end, okay? It's a team effort. We do our part, but are you ready to do what it takes to do on your part, right? So what we do basically when you come in is get the stuff out that you can't clean out at home when you're properly cleaning your teeth. At home, you're not going to be able to get everything out. So what we do is we get to those areas that you can't get to get them cleaned out for you. We get the stuff out that you cannot get out at home that builds up over time, okay? So floss, brush, that's what you're supposed to do, okay? You're supposed to floss and brush every day. If you can. A lot of people don't floss. You should. But hey, just make sure you come in. But don't expect our cleanings to make up for the stuff that you don't do at home. That doesn't work that way, okay? What we do is help stabilize your gums and get rid of the stuff that is not going to be easily removed at home. It's just stuff that builds up over time. How should I schedule a dental hygiene appointment? It's very easy. Just call our office, okay? Or call your dental office if you're not around where our office is. So just call, and we usually answer the phone by the third ring. We get you in within a week, by latest 2 weeks. If you have an office that cannot get you in within 2 weeks, find another office, okay? Because your health is important. Don't just wait, okay? Some people say that they fall off the bandwagon. They need to reschedule their hygiene, and they can't get in for months. That is not okay. You should not do that. You got to get in right away, okay? So that's part of being good customer service, and that's part of us expecting you to do your share, and we're going to do our share by having you come in right away to take good care of you. You can call our office. Hopefully I've answered a lot of the questions that you guys have had. If you need to come in for a cleaning, if you're interested in having healthier gums and being the best version of your healthy self with your healthiest gums possible, give us a call, 925-254-4043. If you found this information useful, please do click the like button at the YouTube channel. Click, smash, destroy, okay? And subscribe to our channel as we have very useful and helpful information for you. Share it with anyone that needs this kind of information and that can benefit from it. All right, we'll see you at the next video. Bye.